Kalyan Krishna from Hyderabad. I was diagnosed with coronavirus, and this is my story how and what all I felt during my quarantine period, and how I eventually recovered from coronavirus. Hi. Today in the morning, I got SMS that my report is available online. I checked it. I was sleepy, and the moment I checked, my sleep went off. It came positive, and I pretty much have mild symptoms like a congestion in my throat, mild sore throat, and I have slight discomfort in my chest area. Apart from that, pretty much I'm okay. I just had lemon rice in my lunch, and I feel that it would subside soon. That's how my day 1 of quarantine went. I'll meet you tomorrow. Hi, this is day 2 of my quarantine. Symptomatic wise, I have the sore throat reduced today, but a new symptom has cropped up. I am having heaviness in my chest. It's as if someone is squeezing my chest from behind. It's a very, very strange feeling. And when you're doing some work, it's as if you're gasping for breath. I have my saturation levels measured by this pulse oximeter. It is showing normal, but still that heaviness is felt in my chest area. I feel this virus is not to be taken lightly. Please do take precautions. I am planning to have my chest x-ray done today in the hospital. I'll be leaving soon after having my breakfast. I just had a glass of lukewarm water with honey and lemon, and 1 teaspoonful of chyawanprash. I'll update you soon. Hi, it is day 3 of my quarantine. Well, technically it is day 5 since I have given my sample for testing, and day 3 since I have received my reports. Well, yesterday I had gone to the hospital for having my chest CT scan done, and it was necessary because the doc wanted to know if I had any pleural effusion in my lungs, any fluid accumulation in my lungs, or if the infection has spread to my lungs too. Well, luckily my chest CT report was normal, and I went to the doc after having my reports done. The doc said that my symptoms were kinda peculiar because I had breathlessness too at times, and I had no fever, and I had no cough, but yes, a bit of sore throat as well as heaviness in the chest at times. I too had body aches too, and he said that these were kind of peculiar because the chest CT reports are normal and I have no pleural effusion in my lungs. Well, I had my another test done too, a D-dimer test as well as my complete blood report, and both of them were normal, and I was advised a home quarantine for 10 days, and my doc has advised me some of the medications to be taken during this course. He actually had advised for Fabiflu, which in the market is not available currently. He also had advised me an alternative for that is hydroxychloroquine HCQ, which is easily available in the market, but it is kind of little bit ineffective compared to Fabiflu. And I have tried for Fabiflu from the market, and I think that I'll be getting it by today evening. I monitor myself, my pulse rate as well as my oxygen saturation levels using this pulse oximeter. My saturation levels stay well above the normal, that is 95-96 at all times, even when I feel a bit of breathlessness, and my pulse rate too stays normal, anything around 70 to 80, and my doctor has advised me to have this pulse oximeter with me at all times and report any deviations from the normal immediately. I would also advise you to have one of this pulse oximeter handy with you, just as a precaution. And yesterday I wanted to share one interesting conversation with my doc. He said that the accepted test around the world, RT-PCR, which is a swab test which gives a result in approximately 1.5 to 2 days, is not to be relied on completely, because he says me that it has a sensitivity just 63%. That means if it is positive, the patient is positive anyways. But if the test report comes as negative, there are some chances that some of them who are also positive realistically, yet the report shows them as negative, and it might be due to various reasons like inefficient viral load, or the test itself has its shortcoming, you would say. So he says that there are a lot many people who are actually positive out there on the roads just because the report shows them as negative, and he had advised that to rule out any possibilities of those cases, it is extremely essential for a person who has COVID symptoms and his report shows him as negative to have a chest CT scan done, in case if the chest CT report shows that there is any fluid accumulation in his lungs or infection in his lungs, in his or her lungs, that might be shown in the report, and it is very easy to diagnose them and give him treatment efficiently and effectively in the shortest span of time. Else, he would have to come to the hospital at the later stages of the infection, and it is very difficult for them to regain their health completely. Today is day 4 of my quarantine. Technically, you can say day 6 after I have given my sample for testing. Symptomatic wise, I have my breathlessness issues reduced, almost next to nil, I can say. But the sore throat, the pain in the throat has increased, as well as I feel a congestion in my throat, and I have recently developed dry cough too. It is aggravating just after eating, and weakness as well as body aches remain the same. I don't feel like doing any work, and I can say that I am at 30 to 40% of my normal energy levels. Rest, everything is under control. My oxygen saturation levels are well enough, beyond 97 and 98, and my pulse rate too stays normal. It varies in between 70 to 80. At times it reaches 92, but yeah, give or take, it is normal. And today I was contacted by COVID Center 104 Arogya Setu team. They had just asked me how I was doing, if I had any problems, and intimate the nearest doctor if at all I have any serious issues. Also, I advised not to venture out of my home quarantine, and I was asked to stay safe. And that's all pretty much. Their duty was over, I guess. Interestingly, or ironically, you can say that when I still open my Arogya Setu app, I'm still shown as safe. You are safe, which is completely absurd. Even after 4 to 5 days of my being tested as positive, I'm still being shown as safe. And this is a thing which I wanted to share you guys with. Hi, this is day 5 of my quarantine. Well, technically day 7, since I had given my sample for testing. Symptomatic wise, I have sore throat, congestion in the throat too, as well as fatigue and body aches. Apart from that, the rest of my vitals are normal. Saturation level is well beyond 97, and pulse rate too is normal. I also have fresh fruits or fresh fruit juice daily, and I have been taking steam along with the eucalyptus oil for clearing my congestion in the throat. I just add some 3 to 4 drops of eucalyptus oil in the vaporizer, and I do have a good steam for at least 5 minutes also, but twice or thrice a day. And I also have this pyro ball, incentive pyro ball, which is very good for your lungs, and I do it on the recommendations of my doctor. I would like to share my diet with you guys, which I had been following since the onset of the symptoms in the past 1 week. I have Chyawanprash twice a day, as well as I have lemon and honey in lukewarm water twice, once in the morning and once in the evening. I do have lukewarm water 3 to 4 times a day, and I have green tea, which is prepared of ginger and tulsi leaves along with honey for sweetness. I also take steam twice to thrice a day, and I have been following a protein rich diet. Like I have nuts like cashews and badam, along with eggs boiled eggs or omelette in the morning. I do have milk, and I use the pepper powder to. Today is day 8 of my quarantine. Well, I have my energy levels little bit improved today, but I have my dry cough increased too. The sore throat which I had has reduced, and the congestion which I had in my throat still remains the same. Fatigue has decreased a bit, and the body aches too have reduced. And I have a new discomfort which I could say, that is a slight discomfort in my abdomen. Also, my tongue feels weird. My tongue feels as if there is some metallic taste in it. Also, I feel a bit insensitive, I would say. Though I could feel the taste and all, still it feels kind of weird in your mouth. My saturation levels are normal, and I don't have any breathing issues which I had in the before. So it's a good sign that you are improving. Hi. This is day 9 of my quarantine. I am feeling a little better than yesterday. I have my sore throat reduced, and my energy levels are better than yesterday. I guess it's around some 60 to 70% of my normal energy levels. Also have my taste back, and though it's not completely normal, but yeah, it's far better than what it was yesterday and day before yesterday. Also, I have my tiredness as well as body aches reduced, and I feel that I'm improving, and I'm using my meds. Hi, this is day 10 of my quarantine. I feel that my body is fighting this virus well enough. I don't have any symptoms as such, except for the slight body pains and well as generalized weakness. Apart from that, I don't have much of any the symptoms which I used to have before. And the only thing I feel that which needs to improve is I feel a slight bit of discomfort in the lung region, I would say. I feel that it's kinda tight and feels a little bit of unease at times. Apart from that, everything is okay and everything is manageable. My saturation levels stays normal, and I don't have any breathing issues. I just had green tea, which soothes your throat as well. And yeah, I'm improving, and I will soon fight off this virus. Hi, this is day 11 of my quarantine. Symptomatic wise, I just have slight body pains as well as generalized weakness in the body. My energy levels are, I guess, some 50% of what used to be in the normal, and I don't feel like doing things now, and I can't even sleep the all day, so it's kinda strange not being able to do things and also not to take rest continuously. And apart from that, I just have uh, slight discomfort while I take a deep breath. I feel a kind of restraint in my lung region, I would say. If you take a normal breath, then there's no pain as such, but if I have a deep breath here, slight discomfort is felt in my lung region, I would say. It kind of feels tight, I would say, in the normal times too. Apart from that, everything is normal. My saturation levels are normal, and I'm having steam as well as warm water. I have reduced my medicines intake. I'm just on vitamin C and vitamin D supplements now, and I have stopped azithromycin. One thing I would like to tell you all is get treated early. That is the only cure for this. In the later stages, it is too difficult, either for the healthcare personnel or for your body, to fight back effectively. And don't get bogged down by what others say and what people say. If fought early in the stages of infection, you would definitely win. It is day 12 of my quarantine. Today I am feeling better than yesterday. My energy levels are better than yesterday. Apart from the slight weakness which I have, everything else is normal. Thankfully, the virus is getting reduced in my body, and the infection which I had seems to be going off. My energy levels are back, not completely to the normal level, but yeah, it's around 60 to 70% of what I used to have. There are no symptoms as such today, but slight weakness and body aches are felt at times. Rest, I feel that I'll be getting out this virus too soon. Hi, it is day 14 of my quarantine. My body energy levels are still down. It is around 40% of what I used to have in the normal times. Also, I have body aches too. They still haven't subsided. I thought as the day passes by, body aches and weakness would subside, but it hasn't happened yet. Hi, this is day 16 of my quarantine. Well, yesterday I was not able to record the video because I had a severe headache in the evening. Today I'm better. My energy levels are better, as well as my body aches have reduced. Still, my energy levels are not the normal which used to be, but yeah, they are quite better than yesterday and day before yesterday. I made my own breakfast as well as lunch today, so pretty well I'm able to do things now, and my saturation levels are normal, as well as I have no breathing issues too. So I feel this virus is getting reduced in my body, and soon I would be fighting off this infection. Hi, this is day 17 of my quarantine. Technically this is the last day of my quarantine, and by today I'm officially removed from the records of the government being a COVID positive. patient. I'll be no longer called a COVID patient from tomorrow onwards. Symptomatic wise, I have no symptoms except for slight weakness in the body, and body aches are quite reduced. I no longer have joint pains which I used to have. Slight muscle aches are there, which is manageable, and it is reducing. The extent of the pains as well as the weakness have drastically reduced, and well, I guess I have recovered from coronavirus, thankfully. Coming to measures which one needs to take in order to prevent this from being infected, I would say is to keep a sanitizer in your pocket at all times, and whenever you touch any surfaces which you are not sure of, please do wash your hands with sanitizer, I would say, and keep the mask on. But the thing is, don't touch your mask too many times, because each time you touch the outer surface of the mask, it is like touching coronavirus itself. So the number of times you touch, make sure you sanitize your hand then and there itself, and do keep sanitizing your phone regularly, so that it too remains off the virus. And as a precautionary measure, I would say please keep a pulse oximeter at your home, so that in the case somebody gets infected in your home, God forbid, you would at least assess his or her situation, and can keep a track of the person's vitals. Else it would be very difficult for a normal person to gauge the vitals of his or her body effectively, and communicate that status of the person to the doctor if needed. Pulse oximeter is not so costly. It would be around $1,500 to $2,000, and it is available online these days. Make sure you have one. And I would say, as a proactive measure, you can improve on your diet, like including Chyawanprash in your diet, as well as sprouts and multivitamin supplements for your increased immunity levels for your body. And as a measure, I would say, to keep this virus from spreading, I would suggest the working people who cannot afford not to go to workplaces like me, to stay away from the family if at all it is possible, because there are situations where one has to go to the workplace, and there are like many occupations where one cannot work from home. In such situations, it would be wise to split the family, as in the employee should not be in contact with other family members at home. He can stay in a separate room or take a separate dwelling at some other place, so that the chain gets broken. Else, just because of one person, the whole family would be affected, and it is a very dangerous situation these days in the hospitals, where there are no beds at all, even in the private hospitals. Even if you pay lakhs of rupees, there is no single oxygen bed available in the private hospitals. And if there are elderly and sick people at your home, it would be very dangerous situation to put them at risk. And I hope you all stay healthy. And if at all somebody gets infected, what I would suggest him is to stay engaged, keep his or her routine engaged in some activity, read books, watch movies online, listen to music, do anything whatever you want, but keep your mind engaged. Don't let negativity take reins of your mind, and that would be a drastic situation wherein because this isolation period creates a lot of trouble for your mind, because it is not your comfort zone for staying put at one place for 17 days long without any contact with the outside world. So I would say keep your mind engaged, keep your body engaged in activities which your body can afford doing, and stay calm. Rest assured, you will soon fight off this virus. This is day 22. Yesterday, that is day 21, I had given my sample for testing, and today I have got the report and it is negative. I am too happy for that. A big shout out to the doctors as well as the whole healthcare team, including nurses, lab technicians, as well as supporting staff who, putting their lives at risk, have helped and saved innumerable lives of patients like me. Heartfelt gratitude for them throughout my life. In my opinion, the doctors, healthcare staff, all of them are no less than defense personnel who put their lives at risk and save the country. The only difference being the defense personnel fight the visible enemy and the healthcare staff are fighting the invisible enemy. Stay safe, stay happy, guys.